This is a very interesting question, and we presented a contribution to EIN. It's an e-poster just to address the different characteristics of patients with resistant, refractory, and non-resistant and non-refractory. And we did a cluster analysis to try to identify homogeneous groups of patients. And we have clearly identified a cluster of patients that is mostly includes patients with resistant and refractory, but includes also an interesting proportion of patients with non-resistant and non-refractory that have the worst profile in terms of comorbidities and in terms of response to treatments. On the other hand, we have identified one other homogeneous cluster of patients that is mostly composed by non-resistant and non-refractory patients, but there's also a very interesting proportion of resistant patients that is characterized by a reduced burden of comorbidities, of other ongoing treatments, of a past medical history that is less complicated, and they do really well with treatments. So it's very important to identify those clusters of homogeneous groups of patients in order to develop targeted treatment for patients that have something strong in common.